Thank you so much for the introduction. I forgot to update it, but I did officially graduate. So finished my doctorate in occupational therapy. So that's exciting. And then I know that one was kind of geared towards feeding, but like it said, I am a mom of 4 kids. One is autistic and one has ADHD, and they all have sensory preferences, like all children do. So that kind of brings another level of background. And I've also done a fellowship in the leadership and education in neurodevelopmental and related disabilities. So that kind of helped with some of these information that I will provide for you today. And then just before we start, if you have a question during the presentation, please feel free to pop it in the chat so we can answer it during the presentation, just because the information builds upon itself. So don't feel like you have to wait to the end, just pop it in. That way we can answer it. So that way you don't get lost, because like I said, it builds upon itself. So like Raneem said, I am an occupational therapist, and I just wanted to give a little bit of a background on occupational therapy in case you don't know what we do. But occupational therapists work with individuals of all ages and all abilities, and our goal is to help individuals be able to do the things that they need to do and want to do. And we do this by engaging them in their valued activities, which is what we call their occupations. And we do this because we believe that what we do is intricately intertwined with who we are, who we become, and how we belong. So occupational therapy in a nutshell. Okay. So today we're going to go over sensory processing. And sensory processing basically describes how we experience the world, because we experience our world through our senses, and then how we perceive those senses impacts how we structure our days, how we structure our routines, and how we engage with others. So as Winnie Dunn put it, sensory processing describes how individuals experience the world through their senses and how they regulate their behavioral responses associated with that sensory information. So basically, sensory processing makes the connection between our sensory input and our behavior or our output. So we all know our 5 basic senses: touch, sight, sound, and taste. And we all know that we have preferences across our sensory system. So this could look like anything such as, do you like touching different textures, or do you avoid certain textures? Is grooming or hair cutting difficult for you or your child, or are certain clothes difficult to put on? Do you like certain fabrics only? Do you not like the tag in the back of your shirt, right? Those are all different types of touch preferences. For sight, when we think about sensory processing, we think about, do we like bright colors? Do we like spinning objects? Do fluorescent lights in school buildings and offices bother our eyes? Do you have a hard time working maybe in a visually cluttered environment, or do you not seem to notice visual clutter in your environment? When it comes to sound, we think about individuals that maybe are sensitive to loud noises, cover their ears, don't like the vacuum being turned on, or we might think about individuals who almost don't notice when you're calling their name. For taste, we think about, does this person like quote unquote more bland food, or they seek out like intense flavors and spices? Do they look for oral input? Like, are they constantly chewing on their shirt or chewing on gum, or do they not like oral input? You know, is brushing your teeth a fight at night? Or can you only eat foods of certain temperatures or foods of certain texture? Those are all types of taste preferences. And then smell is another one that we talk about. You know, do you enjoy different scents in your environment, or do you get very sensitive to scents? So those are our 5 basic senses, and most of us have a pretty good understanding of those. And we also have 3 more senses, which are what we kind of refer to as our hidden senses. So the first hidden sense is movement, which is what we would call the vestibular sense. And it basically provides you information about your movement and your balance. So some people might seek out movement, you know, the people that like the spinning rides or always kind of want to be running and jumping. Some of us, movement might be a little bit much, and we might be more prone to motion sickness. So that's kind of the movement sense. Then we have our position in space, or what we call proprioception. And basically, this is the acknowledging that you have receptors in your body that know where your body is in space. So if you stick your arm out, you can relatively tell where it is without having to look at it. And this allows you to go and navigate your environment without bumping into things for the most part, or knowing how much a pressure to apply. So you're going to use light pressure if you're doing something like writing with a pencil versus opening a jar. This also can be why some of us are more prone to bump into items, or more prone to be like clumsy, as we would say. And then our last hidden sense is my favorite sense of all. It's what we call our internal state, or interoception. And it is basically the senses of our internal organs. So how we know that we're hungry, right? How we feel that sensation from our stomach, how we know if we have to use the restroom for our bladder, how we know if we're hot or we're cold, if we're feeling pain, if our heartbeat is speeding up, if our muscles are tense, right? So any kind of internal sensation is what we call interoception. And the reason why this is one of my favorite senses, and that we sometimes, another reason why sensory processing is so important, is I think it ties very closely to emotional regulation in adults and children. And so part of that is sometimes, even we as adults, we will tense up, or our heart rate will start spiking, and we're not realizing that we're kind of entering like a elevated emotional state. So sometimes if we can teach children and ourselves how to recognize those symbols of elevated emotional states by listening to our body, then that can help with some of the emotional regulation. And that's why we sometimes have people do, what are they called, like check-ins with their body. It also is really correlated with things like potty training, or, even hunger can affect our emotional state. So if we're not realizing that we're hungry, or our child's not realizing that they're hungry, they might get dysregulated. So I think interoception is one that's really interesting to think about when it comes to sensory processing and how it relates to emotional regulation. We'll talk a little bit more about that, but that's probably also why it's my favorite sense. So those are kind of our senses and a broad overview of our sensory system. Now we'll go into like the nitty gritty of sensory processing. When you hear about sensory processing, there are two main models out there about sensory processing. The first model is called sensory integration, and it was pioneered by Jane Ayers, and she kind of got occupational therapists and the public thinking about sensory. And then there's the second model, which is called sensory processing, which was pioneered by Winnie Dunn. And that is the model that we're going to focus on for this presentation. I chose Winnie's model because while Jean got us thinking about sensory processing, Winnie's model is more evidence-based, it's more strengths-based, and it's more occupation-based. And so what I mean by that is sensory integration will sometimes use these isolated treatments that you wouldn't necessarily do in your daily life, whereas the sensory processing model figures out how to do things in your daily life to help. So that's what I mean by occupation-based. So Winnie Dunn's model kind of has two components. So your sensory processing is made up of your detection threshold and your regulation strategy, and that defines kind of an individual's sensory processing. So we'll start off with the detection threshold. A detection threshold basically describes how quickly an individual notices a sensation. So we're thinking about it from a neurological or brain perspective. This is how quickly your nervous system is going to respond to a stimulus. So if your nervous system, your brain responds to a stimulus really quickly, we say you have a low detection threshold. So a child with a low detection threshold might hear a sound and they might notice it before other people in the room, right? Their body is responding quickly to that sound, and that could lead to them becoming maybe more overwhelmed by a sound that we might think of as normal volume, or maybe even a loud volume. If a nervous system is going to respond slowly to a stimulus, we say they have a high threshold for responding. So a child with a high threshold, if we're keeping with sound, might not notice someone calling their name, right? Their brain is not picking up on that stimulus. They need it to be louder or more visible for it to pick up. So our nervous system tries to balance, right? We want to be aware and attentive, hear that, but we don't want to be overloaded with input. I like to think of it as a coffee cup. So some of us have small coffee cups. It doesn't take a lot to fill us up. That's a low threshold, right? We don't need a lot of caffeine. We're already kind of energetic. If we get too much input, then it overflows and we become overstimulated. If you think about a child that has a lot of energy, right? Overstimulated, or we might struggle to regulate. So the small coffee cup, low threshold. Some of us have large coffee cups, so it's going to take a lot of input, a lot of coffee to wake us up. These are individuals with high thresholds, so they need more input before they notice anything before they wake up. And just like with our, coffee cup, we want a balance. We want the right level of caffeine for our individual body so that we're alert, but we're not overstimulated. Okay. And then, so that's one part of the equation. The next part of the equation is your self-regulation strategy. So this describes how you respond to a sensation. So you can respond with an active strategy or a passive strategy. So if we go back to sound, let's say that child that heard a loud sound, okay, they can respond actively, which would be something like covering their ears, leaving the room, putting on headphones, right? They're working to control the amount of input that their body is getting, and they're actively doing something about it. That would be an active response. A child with a passive response is not going to do something about the input. So its body is overwhelmed by that loud noise. They might kind of withdraw, cry, complain about it, but they're not doing anything to actively control how much input is coming into their body. So the regulation strategy just kind of decides if you're going to do something to control the input or not to control the input. Oh. Okay. So when you put these two things together, you get 4 different patterns here. And I kind of have a graph. I hope it's not overwhelming. We're going to go into each pattern individually in the next slide. But I did want to note that while we mention these as like distinct, nice little patterns, sensory processing occurs on a continuum, and every individual has distinct preferences. So your sensory preference could change based on the activity you're doing, the context, the time of day, etc. And so what I mean by that is, as a caregiver, you might be more tolerant of noise in the morning, right? Or more tolerant of touch. You haven't been sat on all day by all your children and talked to. So you might have a higher threshold for noise. And then as the day goes on, your threshold might lower and you might need less noise. It also means that a child who's averse to playing with Play-Doh, who maybe has that touch sensitivity to Play-Doh, might love water, right? Different sensation. So our sensory patterns are going to be unique based on our context, time of day, and the activity that we're doing. Another thing that I want to note here is that a lot of times when we talk about sensory processing, we're talking about individuals with diagnoses, right? ADHD, autism, but everybody has a sensory processing or sensory preference, right? And everybody with a diagnosis has a preference. So we all have sounds that we like or don't. We all have smells that we like or don't. We all have sensory processing preferences. All right, so now we're going to dive a little bit deeper into those 4 different types of patterns. So a bystander is someone who has a high threshold. So we're thinking big coffee cup. It takes a lot of information for them to, or it takes a big stimulus for them to notice it. And they have a passive regulation strategy. So this person might take longer to notice sensory information, or they might need that information to be more intense in order to notice it. These individuals are generally very easygoing, right? They're not going to be bothered by loud noises or discluttered areas. They're more likely to miss that information. So they tend to be pretty easygoing individuals. Some things that you might see for bystanders, they might not notice a teacher calling their name or a parent calling their name. They might not notice their clothes being twisted on their body. They might not notice somebody entering a room, or they might not notice maybe that their environment has become messy and they need to clean it up. So those are bystanders. The next ones are sensors. They also have that big coffee cup, so it takes a lot for them to notice information, but they have an active regulation strategy. So rather than kind of sitting back and waiting for their coffee cup to be filled, they're going to go out and seek that input. So we call them seekers. They are seen as active individuals and continually engaged. They are always creating new play scenarios or creative ways to work. Seekers, you might see in a child is that child that wants to touch everything, right? They're walking down the hall, touching the walls, or they walk into a store and they can't help but touch everything that they see. They might be chewing on things, tapping their fingers, fidgeting, making noise. They might be the ones that you see wrapping their legs around their chairs or wrapping themselves around you because they want to get that touch input that they need to stay alert. They might like bright colors or need the lights to be on really bright. They might be really noisy, right? So they are actively going to seek out that input to fill their coffee cup. One thing with seekers is that sometimes we see that seeking behavior, kind of like the kid that almost feels like they're running on a motor when children are dysregulated. And so we might think, oh, they need more input because they're seeking it out, when in fact, they actually need less input. So I will say what you're looking for when you're trying to identify your child's sensory processing pattern is something that's consistent throughout the day. So observing them on multiple occasions, because sometimes when you see kids that get dysregulated, overtired, they might be, full of that silly energy, but really they're just overtired rather than a seeker. That's kind of just one caveat with seekers or with seeking behavior that we see. Okay, so now we're going to go shift to our small coffee cup people. So those are the ones that don't need a lot of input before they get overwhelmed. So avoiders have that low threshold, but they have an active regulation strategy. So they detect information quickly and then they actively attempt to disengage. They might prefer to work alone and they might seem withdrawn. They might be hesitant to try new food, right? They know that taste might be too much for them, so they're not going to try it. They may cover their eyes or ears to avoid input. And like I said, they may choose to work alone. Our sensors are also our small coffee cup kids, right? So they don't need a lot of information to notice something, and too much information, their cup starts overflowing and they're overwhelmed. But they have a passive regulation strategy. So they detect information quickly, but they are not actively attempting to disengage. These are known to prefer certain types of food, clothing, they benefit from routine. So the way I like to think about it is our avoiders will sometimes put into practice things to help them avoid input, whereas our sensors might need us as parents or guardians to help put more of those things into their day in the form of routines or, providing them with certain types of clothing that we know that fits their needs. So I will talk about, we just talked about all the why do we care? And so I have a picture of a child with a light switch here. We had a client come into our feeding clinic one day and his parents were with him and he kept turning on and off the light switch. And the parents were trying to, get the child away to stop play with the light switch. And we went on to the session and the session ended and they left. And I realized that the child was actually not turning it on and off. They were turning it off only. So, they would turn it off, the parents would turn it back on and they would try and get the child to come away from the light switch. And what they were interpreting as a behavior, right, trying to play with the light switch, when we noticed that he was only turning it off, it switched into thinking, oh, maybe this child is bothered by the fluorescent lights that we have, in hospitals. And maybe they were trying to actively regulate and get less input. So I think sometimes I had missed it during the session. Of course, the session ended and right away I recognized what I had missed. But if we can look at how our children have sensory preferences, it can help us determine what they need to support themselves. And it helps us because sometimes what we might perceive as a behavior, right? Oh, they're trying to play with the lights, which is really just them trying to meet their sensory need. So it's really about helping our children be the most successful that they can be. Right? It's really about what we call participation because we want our kids to be able to participate in their activities throughout the day in a way that's comfortable to them, in a way that's getting done, all the things that they have to do, school, friendships, hygiene, but also in a way that's going to make them successful. Right? And we call participation as being engaged in our desired occupations or activities in ways that are personally satisfying and congruent with the expectations within the culture. And just to tell you, this slide's maybe slightly overwhelming. There is research behind the effect that sensory processing can have on participation. Like I said, some of the research is more recent and have smaller groups of people that it's been done on. So I do think that there needs to be more research, but I do think that there is a lot of evidence out there. So for example, children that are under-responsive or have small coffee cups when it comes to sound or verbal input, they are more likely to underachieve academically. So if we know that, we can put things in place to help them succeed in the classroom. Children who are scored as bystanders or seekers, so those are big coffee cup kids, they're more likely to have lower scores on social adaptive skills measures. So I think of one of my sons who has ADHD. He's a seeker, right? But he sometimes doesn't realize the input he's giving is too much for other kids. And so we are working on some of those social skills, right? So it's just kind of being aware of that. Children with high scores in any of the 4 processing patterns are more likely to have challenging mealtime behaviors. Maybe it's that seeker trying to get up and move, or maybe it's that avoider that does not want to try new food. Children with sensory voiding patterns have more sleep disturbances. And part of that is because we lay down, we might not notice the sound of the air conditioning or this light in the hallway, right? But they're a little bit more aware of it. They have smaller coffee cups, so that can sometimes make it more difficult for them to fall asleep. In addition, we know that children are more likely to be interested in leisure activities that match their sensory needs. So I think about like my son that's a seeker. When he is put in a goalie in soccer, he turns around and says, this is boring, right? Like that is not going to meet his sensory needs. So we want to try and find things that are going to match their needs for their leisure activities. We know that children with low thresholds or those small coffee cups are sometimes at higher risk for developing anxiety and depression. And we know that children with sensory processing differences, so those are ones kind of on the extremes of the spectrum, experience lower participation in activities overall and enjoyment in activities. So we know that sensory processing is impacting their daily lives and their participation in some ways that are meaningful. Cool. So this brings us back. We know what it is. We know why it's important. What can we do about it? So occupational therapists love their theories, love their frameworks, and this is one of them. It's called person, environment, occupation. And basically it highlights the different areas we can look at when we're designing an intervention. So if we're thinking about, the child is having a hard time sleeping, we can look at the person, the environment, and the occupation, which is sleeping. The sensory processing framework, which is the one that we're working under, mostly looks at focusing on changing 2 things, and that's the environment and the occupation. And we can change those to support the child and help make their participation easier. We generally speaking do not focus on changing the person. And we can use their sensory processing pattern as a guide for how we can modify and adapt the activities in the environment so they can engage more. So if you think about the environment, we can modify our environment and provide adaptations to help meet individual sensory needs. So something like a seeker, maybe who's stimming, when you think of like art flapping their hands, or there's lots of more socially acceptable ways of stimming that we don't notice. Chewing your fingernails is a way to give input. Twirling your hair is a way to give input, right? Allowing that stimming to happen allows them to increase their input to meet their needs. We can provide noise canceling headphones for our individuals that are noise sensitive. We can use lamps, or they even have like covers for halogen lights to help those that are visually sensitive, or allowing sunglasses inside. We can use visual schedules if someone is more responsive to visual input instead of auditory, right? We can sit a child in the front of the room if they're distracted by visual input rather than in the back of the room. So there's lots of different environmental changes that we can make that support a child's sensory processing preferences. Then the next thing that we can look at is the occupation or the activity. So it's basically modifying what you're doing. So if you have an individual with a high threshold for sound, big coffee cup, who seems to, need a lot of input before he notices you're talking to them, maybe use a visual cue. I worked with a child in the school setting who had ADHD, and he had a really hard time with impulse control. So we would play a red light, green light to kind of work on that impulse control, but rather than giving him a verbal cue of red light, green light, we worked on colored cards. So green card, red card. And then we modified it to eventually as cleaning up toys. So that was a transition he struggled with. And so we would kind of give him a visual of when to clean up toys. So once we had gotten good at understanding start, stop, right? We did stop picking or stop playing and clean up. So you can kind of work those visuals rather than those verbals into transitions. I had another child that was really sensitive to touch. And so when painting would come out, he would get really distraught. So we ended up using water to paint with on a brush rather than paint, because that was less aversive to that child. So if you're thinking about like even at mealtime, providing maybe extra utensils for things that we normally would eat with our fingers can help a child who maybe has some touch sensitivity. So we have person here, which I mentioned we don't generally want to touch because we all have preferences. We all have differences, and we want to honor those individuals' differences, and we don't want to change the individual. What we can do when it comes to the person is we can help teach them strategies. We can help teach them how to recognize their needs and then meet them. So for example, my son who's autistic, he has a sensitivity to noise. So making sure that he knows where his noise canceling headphones are and helping first, we just, started handing them to him when he started to get overwhelmed, and now he can go out and get them and knows how to request them. So we're not trying to change his preference. We're just trying to equip the person with the tools that they need and the ability that they need to recognize their internal state. It could be like helping your child with a body check, recognize what's going on in their body so that they can more accurately meet their needs, especially as we hope that they grow up and leave us. So these are just some broad examples of what you can do to provide children with some modifications. So we can provide more intense input for kids. We can provide more opportunities to get that input and incorporate it into everyday tasks for our high threshold kids. So it could be something, that kid that likes movement, maybe before dinner, they can set the table. So they're getting some of that physical movement of walking, they're feeling the weight, which kind of helps with some like proprioception of the plates, just kind of ways to incorporate that input in everyday tasks. And for our lower threshold kids, we can try and help minimize the extra input and honor the need for less. There is a current trend in trying to expose our children to input to kind of desensitize them. I would strongly suggest against that and more honoring their need rather than expecting repeated exposure to change the child. Now, like I said earlier, sensory processing patterns can change throughout the day or the context. You might be more tolerant of noise in the morning, but need silence at night. And we know that individuals can have unique combinations of sensory patterns. So you might enjoy strong scents, but you are really sensitive to textures and clothes, right? A bright, loud stadium might be too much, but you can do okay in a dark movie theater. So it's just really important that while we have these broad categories, we're looking really specifically at the individual, the context, and the specific sense, if that makes sense. So we have 2 case studies, and he based them on my own children. I thought we kind of would go over what we're seeing, how to identify their sensory processing pattern, and then what are some things that we could do to help them. So our first case study is Carson. He's a 7-year-old boy. He's always active and does not stay with a seated activity for long. At mealtime, he's constantly getting out of his seat or he's laying himself across his mom. He often places his shoes on the wrong feet or will walk around with his clothes twisted or bunched. So like I said, I base these off of my own children just because it was easy. We showed up to swim yesterday and he had his shirt on inside out and his swim trunks on backwards. Like that's just how he rolls. He struggles to use an indoor voice and may often not hear his parents' instructions. Rewards and punishments have not helped. So, if you can put in the chat, and if someone could read me the responses, what do you think his sensory processing pattern is based on that information? And then if you can also put in there, what are some things that we could do to help increase his participation? Trying to see if I can, maybe I can see that. Oh, I can see the chat. Okay.
So we have Stephanie in the chat. She said seeking.
Seeking, yeah. He's a seeker, right? So here are some of the clues. Always active, doesn't stay seated. So he's seeking movement because he needs it and he's going to get it, right? He's not staying seated, he's actually going out to get it. Laying across people, that's often seeking that need for touch or like that deep pressure input. Let's see, shoes on wrong feet, kind of more bystander, right? He's not noticing that his shoes are on the wrong feet because that level of input has not hit his brain. Clothes twisted, he is not noticing that touch, that his waistband is twisted. Struggling to use an indoor voice, it's not registering with him that he's being loud. Not hearing instructions, that verbal input is not registering either. So he's kind of a seeker with a couple bystander traits in there. Does anyone have any ideas of some, if this was your child or someone that you're working with, what you would suggest to a parent or yourself to help with this child's participation? Sorry, sometimes the
So
Oh, sorry, I got one message saying let him set the table.
yes. Yeah, exactly. Right. So if at mealtime he's constantly getting out of his seat, that's showing that he needs some movement. So maybe we could devise something before mealtime that allows him to get movement. That's part of your routine. And so the reason I say this is, one time I was working with someone and I'm like, well, yeah, just have him go jump on the trampoline for 15 minutes before meal times. And that might work for some families. For some families, you're like, I don't have 15 minutes where he can go out there and be doing that. So setting the table is one way for him to get that movement need before mealtime that might help him sit better at mealtime. Another thing that you can do is they have those, they're called like wiggle pads. So they're these little bumpy pads that you can put on their seat that allow them to kind of move their bottom around and get that extra input, even with pressure and movement, that helps them still stay seated at the meal. Laying himself across his mom, he might need some of that touch input. So, giving him maybe that little textured thing to sit on would give him some input there. Shoes on the wrong feet, you could put a visual on the inside, or sometimes, honestly, we let it go, right? It is not hurting his participation and he will eventually learn, but you can put a circle cut in half on each side to give him visual input since he's not noticing when his shoes are on the wrong feet based on the touch input. Struggling to use an indoor voice, I think a lot of times practicing or even giving them a visual, we have like a strip that has different volumes and telling him when he's at that volume, so then he can adjust it himself. Not hearing his parents' instructions is really not hearing that audio input. So we use a lot of visuals. Proximity really helps because then you're close to them. So they're getting that additional input rather than, you don't want to yell, right? We don't want to increase the input by yelling. So those are some things that you could do to help with this child.
we do have another comment saying, see if he has a preference and would like pressure, hugs, weighted blankets, tapping, or tracing.
Yes, and I will say, with the weighted blankets and vests, we are seeing a lot of use of those. There's mixed evidence right now if those help individuals. And so I would definitely say if you're going to use one of those with your child, oftentimes I would have an order. So usually you have to like have at least if we are going to use them, we have to have an order from a physician or from an OT to use them in certain settings. And then also about 20 minutes after it's put on is when the effect starts to wear off. And they're pretty child-based. So I would just say if you're going to use that one, make sure you're taking some like diary data to see if it's actually helping your child, because the evidence is still pretty mixed out on that one. Okay. So case study 2 is Graham. Graham is a 5-year-old boy. He walks primarily on his toes and he avoids touching certain textures to the extent that meal times are often end in a fight or him refusing to eat. If he gets a drop of water on himself, he requires a change of clothes. He's been seen to cover his ears at loud noises and has been described as a picky eater. So same 2 questions. First, what are some of the patterns that you are seeing here? And then if you want to just throw in the chat at the same time, what are some of the things that you might suggest? And if you don't remember the names of them, you could put like big coffee cup, little coffee cup, active, passive. So I think it's more important that we understand them than the actual names of them. Yeah, so avoiding stimulus. So that's like a low threshold, right? So small coffee cups. With walking on your toes, that could be avoiding the feeling your feet on the ground. Toe walking is a little tricky because sometimes when you walk on your toes, you get tight hamstrings, which makes it harder to walk with flat feet. So sometimes that can build on itself. But we sometimes see with children walking on their toes, they're trying to avoid that input on the ground. Sorry. He's avoiding certain textures, refusing to eat, picky eater, right? So he might not like a lot of different flavors. He might be more bland, not liking that sensation of water on his clothes, sensitive to noise. So things that we do, right? We're just going to provide it with adaptations to our environment, give him those noise canceling headphones for his ears, allow him to change it clothes, right? We might just have an extra pair in our bag rather than trying to work on sitting through the discomfort. With picky meals, just really trying to provide increased time to get comfortable with the food. Maybe putting shoes on so that way he doesn't have as much feeling on the ground, things like that. Okay, so the next one is in your guys's registration, there were 5 true or false questions. Oh, does having too many options to play with create difficulty down the line for focus with an autistic child? So I will say that research has shown that having fewer items out leads to more creative play and more children being like willing to play with items. And having, yes. So kind of, yes. And I'm not sure it's necessarily specific to autistic children. I think they've shown that across typically developing children too. I would say maybe with the autistic child, if they have a small coffee cup or, maybe are an avoider, having too many options out could be visually cluttering, which can be not fitting the sensory preference of the child. So reducing the options and making them kind of less cluttered, so putting it in a clear bin so they can still see it, but it's neat, can be very helpful. But they have actually shown for most children that having fewer options out leads to more creative play and more frequent play. Okay, sorry. So we sent out 5 true or false questions, and I just kind of wanted to review them with our last a little bit here. So the first question was fact or fiction. Individuals with sensory processing differences are diagnosed with sensory processing disorder. And so this one was fiction. So the term sensory processing disorder, it's one that's getting thrown out there a lot, both inside and outside the field of occupational therapy. However, it is not an official term in our Diagnostic and Statistical Manual of Mental Disorders. And the American Academy of Pediatrics has actually issued a statement on sensory processing disorders that suggests the term should not be used, but rather they should place emphasis on daily life and acknowledging preferences. So I say this because people are throwing around the term disorder, but because it's not in the DSM or the Diagnostic Statistical Manual, we really don't have agreed upon definition of this to diagnose it. So there's no, to be diagnosed with autism, you have to meet certain criteria. There's no agreed upon criteria for sensory processing disorder. So that's one problem when we talk about that term, is we're not actually accurately, agreeing upon a set of standard diagnostic criteria. The other problem that I see is that it's kind of taking our preferences and giving them like a disorder, rather than just acknowledging that we're all individuals and we all have processing preferences. So that's why I would hesitate to use that term, and I would just more say sensory processing preferences, or even differences if you want to acknowledge that, maybe their differences are more on one end of the spectrum. So the next question was fact or fiction. That intervention must be offered for individuals with sensory processing differences. And this one is fiction. We only need to offer an intervention if there is a mismatch that is impacting participation. So, for example, stimming, right? If a child is able to stim and without impacting their participation, we don't need to intervene. We don't need to change anything about that. If a child's preference is impacting their ability to participate in something like school, then we would now start looking at some ways to modify the environment or the occupation. But it's not always necessary that we intervene. It's just when it's impacting their ability to participate. So the next factor fiction is one example of an evidence-based intervention for sensory processing differences includes a sensory diet. So sensory diets are become very popular in conversations these days, but a lot of times the sensory diet components, such as brushing protocols, are not evidence-based. And we find that it's better to focus our interventions on daily life and integrating things into our routine that support our sensory processing preferences rather than a diet. And I like to think of it, a lot of us are used to diets being not recommended as much anymore when we think about like a food diet, because a lot of times a food diet is for a short period of time and they're not so sustainable. So we make like lifestyle changes. It's kind of similar with that. We don't want to focus on a diet with a prescribed amount of input or this, because it's not very sustainable for our daily lives. We want to look instead at a routine and our daily life to figure out how we can best adjust that to meet needs. The next one was intervention should focus on changing the environment or the activity rather than the person. And that one was a fact, because we don't want to, we want to acknowledge differences in people without rather trying to pathologize them. And then the last one is that sensory processing preferences are consistent. And that one is fiction, because our preferences are impacted by our context, our task, and our time. So we have shown different responses across different tasks and environments and even different times of day, like we kind of talked about. So those are some of the references, but now we have time for questions if anyone has them.